Let's continue the discussion on the NPP manifesto, which was launched last weekend. And today's focus is on the health sector and other social interventions. We're joined on Zoom by the country director for SEND Ghana, George Osei-Obimpe. Mr. Osei-Obimpe, talk to me about your first impressions of the manifesto.
Well, for me, anytime a political party talks about a manifesto, few things come to mind. One, the desire to win power and the genuine intent to make a change in the lives of the people. To answer the question of the genuine intent to make a desire of the people, I asked some few questions. How responsive is the manifesto to the needs and aspirations of the citizens? If you can answer that, the next question will be, how adequate is that in the sense of, in the sense of how many people can benefit from the manifesto? Oftentimes, some ideas, laudable as they may appear, may be practicable and viable, but they end up improving the lives of few at the expense of the majority. So I look at that. Then I ask the question of at what cost? What will be the cost? What will be the opportunity cost, and what will be the cost in terms of finances? What will be the cost in terms of social and environmental impact on the lives of the people? And if we can answer some of these, even answer the question of, could it have been something else? What would be the multiplier effect of the proposal that the politicians are putting forward? Then we can say that we can answer the question. If I look at the NPP manifesto, I just oppose it to the 2016 one. The 2016 one had about 66 or 68 pages, if my memory serves me right. What was unique about the 2016 one was that it was smart, it was time-bound, there were clear indicators and benchmarks. Unfortunately, the 2021 is quite voluminous, about over 200 pages. But you read from page 1 to page 151, it's all about what they have done and where they are. It is only in the subsequent chapters, exactly 33 pages, if you want to even include the relevant section, the pictures in that relevant section, about what they intend to do. And it has only been largely listed in bullet format. And it doesn't provide the benchmark, it doesn't provide the target, it doesn't provide the timelines. And that in itself is problematic in terms of accountability, because practically, if you want, if they are able to win power and we want to ask them questions about the manifesto, they will say that we did not give timeline. We know the politicians, many of them have been saying that in this country, and that in itself is problematic. But the fact that it also builds on their own achievement, I think we can debate it whether they indeed have achieved those that they claim to have achieved as captured in the manifesto. The fact that it builds and it seeks to consolidate is a good effort that I take note of.
Right. Now, let's talk about the specifics of health care delivery in particular. We know that they originally promised to build 88 district hospitals by the end of 2020, this year. This now appears in the manifesto. As a watcher of the sector, how do you respond to that? How do you react to that?
Well, actually, they have even increased it to, I think, 101.
That's right.
Because they will be providing regional hospitals in those newly created regions, and they will also be providing some disease centers, I think 3 of them in the 3 ecological zones. Well, It's quite intriguing, to say the least, that they made such a promise and we did not hear about it until COVID-19 reality, became obvious to us. And so the president more or less reiterated that promise. But the fact that it has found itself here again, I think here I will leave the judgment to the citizens, because if they couldn't do anything about it in the previous one, and now they are even seeking to increase it and adding more to it, I am not so sure how that will be done, especially when it is not clear how those will be financed, because one of the things about the manifesto that I thought they could have provided a lot more information on is the financing arrangement. I mean, in other words, how they seek to improve on local domestic revenue mobilization. That is not so clear, apart from the point they make about digitization of the economy, re-evaluation of property, property values, and that in itself, I mean, those ones will even go to the local government or local the district assemblies. So it is not clear, and I am not so sure. Maybe as we go on, they would come and provide a lot more information as to how this time around they will deliver it. But as you rightly put it, they didn't do much about the promise of providing hospitals for each district that didn't have one.
Right. They've also talked about how they want to focus on health promotion as a preventive measure, to save the amount of money that we spend traditionally on treating ailments. So they want to promote good health so that people don't need hospitals so much. They've also talked about improving the turnaround time for making payments on to NHIA suppliers so that people can access.
I think that is a good one, because you see, primary healthcare entails prevention, and I think they should have added behavioral change as well as curative measures. So for them to be putting emphasis on preventive care, for me, is a good thing that deserves some commendation, because you see the disease burden. Oftentimes we have waited and created conditions for people to be burdened with disease before we provide intervention. But if we can begin to change people's behavior, our eating habit, drinking, smoking, cultivating habits such as exercising regularly and so on and so forth, eating well, and providing health education to the people, so that in the first place we can avoid that. So for me, when I saw that they intend to spend resources to prevent disease from occurring in the first place, that is a good way to go, because then they are now coming back to some of the points that some of us have been making, that we need to have a comprehensive primary health care strategy as a channel for attaining universal health care. And I see that clearly spelled out in their manifesto, and I think that is a positive that I saw in that regard. The question is the resource side. You see, oftentimes the intents, when the politicians state these intentions, they do not specify clearly how they intend to fund such interventions. Like I said, 2016, in some of the interventions they proposed, they did well by stipulating how they intended to do so. In this particular one, apart from the fact that they are looking at the financial sustainability of the national health insurance, they didn't quite go beyond expenditures that fall outside the purview of the National Insurance Authority to indicate how they will resolve that. But I hope that as time goes on and as the engagement goes on, they will come clear on some of these nebulous areas.
Right. Now, I want us to talk a bit about another thing in the manifesto, the establishment of cancer centers, and also a plan to extend the reach of covering treatments for cancers under the NHIA. Now, we're joined by the National President for the Coalition of NGOs in Health, Gabriel Benarkuu. Mr. Benarkuu, thank you for your time. Maybe we will start with the cancer centers and the extension of payments for cancer treatment under NHIA. Good move?
Yeah, thank you, and good afternoon to all of you. I'm in the field, so forgive me for that. But before I make comment, I think I will need to comment on the document. The document is voluminous, quite articulate on what they have done and what they are seeking for. But on a more serious note, I think that they have not learned from the 2016, and they have not learned from the feedback severally that has been given to them as from civil society. And this is not a good thing politicians will want to do. Political parties will always have to take feedback from civil society because we are much on the ground than what they can ever do. And so we haven't seen much from civil society. But also looking at the document, it's about 216 pages or so. Given the situation of Ghanaians, one wonders how Ghanaians will be able to go through that and be able to make a decision. But I mean, that's their choice, and a good feedback to them is that they will have to have an abridged version of this. Otherwise, it will be difficult for we, the middle class, high-level people, to be able to have time to go through all this. The issue of cancer, issue of the national health insurance, issue of health education and health promotion, that goes together in a nutshell, can be termed as preventive health approach, has been seen in a very simple term in the manifesto. And I think that is not very articulate enough for us as civil society. But we also think that the manifesto must be smarter, not even smart. We have gone away from smart manifestos. If you look at 2012, 2016, the two major political parties received a lot of support and a lot of engagement from civil society. So we do not expect a manifesto now from a major political party to be quite simple and very ambiguous. I mean, coming from our history. So we intend to engage the political parties. We want to be a bit mild now. And we, the Coalition of NGOs in Health, would like to create a platform for the two major political parties to really articulate what they mean in their manifesto. And then we will help them to develop a framework and hold them accountable should any of them win. And that is what I think I will say for now. I will want us to wait for the other political parties to come out with theirs, and then we can now hold a roundtable discussion with them.
Right. Mr. Benarkuu, while I have you, I'm happy to be corrected in case I am the one who missed it, but I've looked through this thing and I couldn't find a single provision in this manifesto for mental health. What does that tell us?
Yes, that's what I'm saying. That you know the way I present my issues passionately, but I want to just forgive the MPP manifesto now. I want to have a very fair and balanced discussion as soon as we get the other political parties' manifestos. We will do the analysis. Currently, we have done the analysis. We are waiting for the others and do it and compare especially the two of them who have tasted government before, and see how it is, and then create a platform to hold them much more responsible.
Right.
Like the health insurance, we have a lot of issues on the health insurance, merging the national health insurance with the health, preventive health. It has correlation, but they need to have two-pronged strategies.
Right.
It must not be one strategy to be able to do that.
Mr. Benarkuu,
talking about the universal access to health care.
Mr. Benarkuu, forgive my interruption, Mr. Benarkuu. I hope you can hear me. Forgive my interruption. I just need to correct this. We have noted that the manifesto lists that there will be the construction of 2 new psychiatric hospitals and rehabilitation of existing ones. So there are going to be 2 more psychiatric hospitals and the existing ones are going to be rehabilitated. Certainly that is not a small thing. But would you assess that to be sufficient, or would you expect more in the area of mental health?
This assessment, the coalition have already published a document on in 2018, we assessed the midway of the ruling government about the delivery, what was contained in the manifesto. We assessed them for after 2 years, and that time they had implemented only 30% of their manifesto delivery. Now that we are in an election year, we have assessed again, and we would like to make this in another platform officially. How they have moved from the 30% after 2 years, we will be able to announce it. But there are critical issues in the health sector, which to me, I think that they have switched off their lenses to receive good feedback, especially with those who are directly working in the health sector. We have given so much information out there that they could have taken advantage. We have researched, we have published that they could have taken advantage. We are not seeing much of the civil society that represent the masses input into the health aspect of their manifesto. But we hope to do a thorough engagement to give a very fair platform for all the political parties and question them, especially the 2 of them who have tasted government. We will question them and let them provide feedback for Ghanaians to decide.
Okay, now let's wrap this up quickly. So at this point, with your assessment, Mr. Obimpe, of what the NPP proposes to do, would you say that if this party were to win, Ghanaians would see an improvement in the delivery and access to healthcare?
Is this question to me?
I think we may have lost Mr. Obimpe. So yes, Mr. Benarkuu, please give us your wrap-up on that last question there.
Yeah, we would like to get more explanation of the issues listed under the health section of the manifesto, so that we can really take a decision on it. It's very scanty now from my perspective, from our understanding in the complexity in the health sector. We have done the research. As I told you, I'm already in the field. We know what Ghanaians want in terms of the current situations. We want to see much of that. We want to meet them, and we want to publish that to them, and want to see whether they will be able to polish it up by taking the issues that we have from the field. And that's why I want to create that fair playing field for the 2 major political parties to engage them and let them have what is happening. And so they will be able to polish it up for further communication to the general public. And we are actually going to hold them responsible for whatever they will say. So having that meeting with them will really bring out issues that we are going to document, and more or less will pursue it during their implementation.
I want to thank you very much for your time with us, Dr. Gabriel Benarkuu, who represents the Coalition of NGOs in Health. He's the president of that coalition. Thank you very much.